As a level 4 epilepsy center, we function as the referral center. So there are many neurologists in the community who can deal with straightforward epilepsy cases. And straightforward means patients who have epilepsy and their epilepsy comes under control with the addition of a seizure medicine. After they've after they're still having seizures and they're already on one medicine, maybe they're on 2 medicines, then at that point they come over to us for a little bit more help, because adding a 3rd medicine to that patient population does not often help to bring their epilepsy under control in a curative way. After they've gone through phase 1, which means scalp EEG, then we might present them at our conference. We have a comprehensive epilepsy surgery conference in which we talk about the semiology, which means how physically the seizures look, how they look electrographically on the EEG. They will also go for other studies, including WADA and neuropsych testing. And the neuropsychologist also attends those meetings with us, along with the functional neurosurgeon. So we meet and we discuss all those cases to decide whether or not we might offer them phase 2 monitoring. And phase 2 monitoring involves more in-depth monitoring. Often it requires a craniotomy, which means we take the skull away and actually physically put the electrodes onto the surface of the brain itself to better determine within a very small diameter where the seizures are coming from. So we might offer them curative surgery.
There can be changes after a surgery has occurred for epilepsy. For example, they typically will see a patient within a month of surgery, may see them again at 6 months and a year. And if they do well after surgery, if they become free of seizures, then at a year's point, we can then have a discussion about going off some of the medications.